Laboratories are staffed by about 33 biomedical scientists. The disciplines within the labs are split between specialties. The specialties include haematology, blood transfusion, clinical chemistry, microbiology, and a few kind of multidisciplinary areas of the lab that have kind of popped up over the last couple of years have been PJI, which is the prosthetic joint infection lab, and COVID testing, obviously. The prosthetic joint infection lab here at the Golden Jubilee has been established as one of 3 labs worldwide. The tests here are for a very specific group of patients. It's very much about prosthetics and joints. Hence the Golden Jubilee was well placed to have this lab. And obviously when the pandemic hit, a lot of the elective surgeries were suspended up and down the country, and with that they suspended orthopaedic clinics, and these are the kind of areas that we would expect to get these samples from. The service here was implemented in January 2020, and we're providing this service on a UK-wide and Northern Ireland basis. We started well, we were getting samples from up and down the country, and then coronavirus hit. Coronavirus has kind of stalled the project, if you like, but not in a way that we're not ready to take any samples. We have the scientists trained and we have the equipment ready to go, and we hope that as the recovery happens, we are trained and ready to provide this service to UK and Ireland. The reduction in the kind of routine workload, because we are first and foremost an elective centre, allowed us to focus on the implementation of molecular COVID testing, which is a completely different area of science for us. COVID testing and any virus testing, pre-COVID, virologists and molecular scientists, that's what they do, that's what their bread and butter is. Our biomedical scientists here are haematologists or biochemists or microbiologists. And while they know about the technology and the principles behind the techniques used to identify a virus, this was completely new. We had to implement that testing on a very multidisciplinary basis among biomedical scientists that would never claim to be molecular scientists or virologists. So they've really stepped up to the mark.
We tried to put things in place here to reassure staff that they were safe at their work. We obviously had risk assessments in place. In my role as training manager, we had to ensure that everybody was trained to use the new pieces of equipment that came in, and that was a big undertaking to make sure everybody was safe. They understood the different safety precautions that they had to take to keep themselves safe. So I think that was one of the challenges, certainly of COVID, was to make sure that when people came in here, that they were safe at their work, as safe as they possibly could be. Different ways of dealing with the samples when they arrived, and people had to be trained to make sure they knew that that's what they were to do. Obviously the increase in PPE, which was obvious to everybody with the masks, but mainly how to deal with the samples and to be trained on the new equipment and how to work in the new areas safely with these potential hazards that they would come across.
We have a microbiology lab that has undergone some massive changes just in the last few months. Not only a couple of huge big pieces of equipment that have been installed and the lab refurbished, painting, benches, new cupboards, all just in the same time that we're trying to provide a multidisciplinary COVID testing, and also to get our patients back in to do the elective surgery. Obviously that full lockdown put us on hold for a while, but we've seen a big increase in the general bacteriology work that's ongoing. So that has, impacted on being able to deal with all of that at the same time.
The first challenge was just testing normal blood samples from potentially positive people caused a great concern for the staff. They were worried about themselves and they were worried about going home with their families. We did a very quality management driven in the labs. We had quite a significant risk assessment carried out on all the procedures that we were doing, all the samples that we were handling. When we realised that we would have to do COVID testing, which is a completely different ball game because you're actually dealing with patients' nasal swabs, so if they've got the virus, it's right there. We have got a category 3 laboratory here, Microbiologists in the department are used to working in category 3 lab, gowned up. It's not something the blood science staff are used to, so that was a big challenge, convincing them that they were safe, and actually convincing them that not only were they safe, they were probably more safe than a lot of people because they were in a negative pressure room, fully gowned up with the appropriate PPE on.
So we have the two different kind of streams, I suppose, if you want to call them that, of the COVID testing. We do still have the analyser that's in the category 3 room, which tends to be for the urgent admit patients, and we do have the Nimbus behind me there, which is the big main analyser, which we batch the samples and we run them together. So yeah, that's obviously been a huge training undertaking, which is still ongoing.
This analytical process takes place in two parts. So when you go to the drive-through to get your swab done, they put it into what we call viral PCR sample solution. Your DNA comes off the swab into that fluid, and then this machine here is the extraction platform. What this is doing is it's extracting the DNA from the patient's sample and purifying it to put it into a white PCR plate. So PCR is polymerase chain reaction. In polymerase chain reaction, what that does is it amplifies the DNA so that the thermocycler here can see what genes are in the sample, if any. Now there's 3 genes being identified that are specific for coronavirus. So this machine is going to do 40 PCR cycles, so it's going to amplify the DNA 40 separate times. If it gets to 40 cycles and it doesn't identify the gene, then the patient is coronavirus negative. If it identifies a single gene, it's potentially coronavirus and it will be repeated on our other platform just to confirm. But if it identifies 2 or more of the 3 genes, the patient has definitely got coronavirus, and that's how it works.
We had a separate risk assessment for dealing with the samples when they came in. If we knew the patients were positive, there was a different risk assessment for dealing with potentially positive patients as well. It wasn't just the ones we knew were positive. So we risk assessed that as well and put the extra steps in place. So yes, very much risk management was heightened, especially at the beginning when we were still very unsure. We probably took maybe precautions that we now know we didn't necessarily need, but at the time we didn't know, and it was about us being as safe as we possibly could be. Now we're returning to a lot of the operations are all starting to come back again, all the elective surgeries are starting back and everything, so we're starting to become busier, and obviously now we also have the added bonus of new equipment.
I think the staff are amazing to be able to juggle what is a whole new set of tests and be able to integrate that into an increased workload as well, and seeing that that has already flown into a pattern, and we have embraced that, and we're getting through the difference in workload and how we approach that. I think it's how quickly, from a laboratory's point of view, I think it's how quickly NHS Scotland has responded to that, lighthouse labs and hubs and everything aside. I think the clinical labs, from my experience coming from GGC and from here, I think it's been, you can see that it's now embedded much easier. We're coping, we have mechanisms in place, risk assessments and everything to make sure that the staff are comfortable with that recovery, as well as that our patients are being, getting the best treatment, the fastest treatment.